I am Izzy, and this is the second episode of the Addiction Assistance series on this channel. I found a very helpful and interesting resource online, and it is presented by the National Institutes of Health, the National Library of Medicine, and it's taken from a book called Counseling Approaches to Promote Recovery from Problematic Substance Use and Related Issues. And this book was published by the SAMHSA organization, the library, and the specific article that has been taken from this book, as presented on the National Institutes of Health website, it deals with myths versus truths about substance use disorders. That's the name of the article. And it's a very interesting resource because it's important to acknowledge common concerns that people have about a patient's treatment or the nature of their disorder. And it's also important to acknowledge the research and evidence side of it. So both sides are completely valid, and it's important to look at both. And so I thought it would be a good thing to analyze this article and to just give my thoughts on it, because this is very important to me, and I hope to one day be able to professionally help people through these troubles and help them just live more joyfully, even though these things can come up in our lives. I want to first and foremost preface this video with the fact that I'm not yet a professional in any way. I'm still in the point of school where you're in the general studies, and so I have not yet had the opportunity to get a professional degree in substance treatment or anything of that nature. And so this is purely, I purely have the intention to just provide some support, provide my insight, because I have experienced family-related addiction, and addiction in my family, in other words, and I hope to just provide my perspectives and how I feel about the information and what it brings to my mind as well, and I hope to highlight things that have proved to be very important in the situations I've experienced as well. So I hope that this video is helpful and informative to you all, and that it provides some support in your life. I would also like to preface this video by saying that if you are personally affected by these matters in any way, I would encourage you to please reach out to a trusted resource, a medical professional, or even just talking about how you feel about these topics is very helpful, and mainly just reaching out to get the help that you need. Thank you all so much for watching this video, and I hope that it's helpful and provide some support. I will now go down this list that we can see here, and I would like to read this list and just give my thoughts about it along the way and how I've experienced these matters that it speaks about. As we can see here, this is taken from chapter 3 of the main book, and the first myth that it highlights is willpower is all one needs to beat addiction. Now, something that I want to highlight from this article, from reading through it previously, is that the words in the myths are typically very definite. In other words, the word that they've used here, which is bringing out the myth aspect of it, is that willpower is all one needs to beat addiction, which means that's the only thing you need, and everything else will just come naturally, and the recovery process will completely just fall in front of you if you have this. Now, this to me is that you need other resources as well. But willpower is extremely important in recovery. I do want to highlight that, because the myth here to me is that it's all you need, which, yes, there are many other aspects of recovery that should be highlighted and are extremely important, but willpower can be extremely powerful, because it's the willingness and the perseverance and the hope for your future that can come from recovery and from seeing the future potential of your life. And so that's very important. However, the actual full evidence through research is this: prolonged substance use alters the way the brain works. The brain sends signals of powerful and intense cravings, which are accompanied by a compulsion to use. These brain changes make it extremely difficult to quit, and often a treatment program is required. So, this essentially means that yes, willpower is an extremely important factor that can be very beneficial in recovery, and I believe can be life changing. However, we do need to understand that the brain is changed through addiction. And as it says here, it sends signals of things that we normally wouldn't send signals of in the typical brain state. And so, because of this compulsion that it creates, it makes it a lot more difficult to plan recovery and think of fully quitting because of that compulsion and because of those changes that can occur. So, willpower can drive that force that is needed. It can drive the perseverance, it can drive the hope, it can drive the positivity, but generally an actual treatment program is needed, and that's extremely important as well. And this article will talk more about that later, and so will I. And so just keeping everything in mind that willpower is very important, but it's not everything typically. Now, I do want to say also, the reason I will be using words like typically, sometimes, a lot of times, oftentimes, it's because we can't make any definite claims in these topics, because every person is different, and we're the same in some ways, but we're all different in other ways. And that's a beautiful thing about our world, that we're all the same in some ways and very, very vastly different in other ways. And so it's great to keep in mind both perspectives, that yes, willpower, extremely important, but also for most people, it isn't everything. And so it's very good to consider both of these things. So again, I'm not making any definite claims for any one person. I'm just wanting to point out what typically we can see, that every person's different, and willpower does benefit typically in recovery, but more is typically needed to help someone and their families through these processes. The second myth that this article states is those with a substance use disorder must hit rock bottom before they can get help. Now, just a little bit about what they mean by rock bottom. This term typically refers to an extreme event or a negative life-changing event that drives one to recovery. In other words, something that makes the person with the addiction go, I need to turn my life around, I can't live like this anymore. These are phrases that are typically associated with rock bottom, and it's extreme life-changing events that drive someone to, or it motivates them to recovery and wanting to get better. Now, again, the key word here that makes this a myth is they must hit rock bottom. Now, this is where, again, the myth comes in. Every person is different, and not everyone needs this life-changing event before they get help. I have, in my life, witnessed as people in my life go through addiction, and as they've recovered, the people in my life, I have seen the rock bottom state in their life, and they have since recovered. And so it does show that it can be a very awakening moment that can motivate someone to want to begin changing their life and to begin recovery. And so it can be beneficial. However, it's not what is crucially needed in every single person. And that's very important to consider, that yes, these things are beneficial, but again, I'll keep reiterating, it's not every person. And that's very complicated and challenging, yes, that everyone's different, but it's also beautiful, and it's good to recognize both sides, that it can be challenging, it is challenging, but it's also a wonderful thing in our world, is that every person has something special to bring, and that every person's brain functions differently, and that's great. But it also brings these implications that we must be aware of when dealing with this. And so the truth side that's listed in the article, I will read now. It says, truth, recovery can begin at any time. Given the impacts on the brain and consequences of substance use disorder, the earlier one can get treatment, the better. The longer a substance use disorder continues, the harder it is to treat. Get help early rather than holding out. Now, yes, in theory, this is the researched probability and truth. So what they mean by this is that, yes, as the brain continues through addiction and the reinforcements in the brain continue occurring and the neural pathways keep forming around this disorder, it can be much harder to get treatment as time progresses. And I have seen this as well, that again, with that reinforcement is such a powerful thing in our brains. And the more reinforcement we have, typically the more we feel compelled to act on that behavior. And so with this, yes, rock bottom, as many cases prove, it can be very beneficial. But as this article states, it's better to try our best to get the help that we need in the most efficient time that we have. And so, yes, it's very important to try to use the time that we have to get help for ourselves or our loved ones. But sometimes it's important to acknowledge that many people who have recovered or are in recovery were driven by life-changing experiences or moments of crisis that turned their life around. However, it's important to note that oftentimes these are dangerous situations. And so we want to always be aware of that instead of encouraging this every time, we want to be aware of other routes that can be taken for recovery. And so, again, we're just looking at both sides objectively, and both sides can be beneficial, but most times we want a concrete treatment plan, and we want to get someone help in a timely manner. And so the next myth that is highlighted by this article is severe substance use disorder is a disease. There's nothing you can do about it. And while this, yes, it is a very captivating disorder, it's a very problematic state that the brain is left in because it's fighting against itself in a way in most people. And again, we want to look at the definite words being used here. There's nothing you can do about it. That is the part that is not true mainly in this statement. That's the part that's making it the myth most prominently here. And the truth side of that is, or rather the truth that it lists after this myth is, most experts agree that substance use disorder is brain-based, but it is possible to recover from a substance use disorder. For most substances, the brain changes related to a substance use disorder can be treated and reversed through therapy, medication, exercise, and other treatments. So yes, this is something I'm a big proponent of, is that yes, substance use disorder is very problematic, very life-changing, very captivating in a negative way. However, it's completely possible to bring changes, positive reinforcement in your life. It's possible to recover. And again, we talk about the willpower can be very beneficial, but typically treatment plans are also super, super helpful for people wanting to get better or in recovery. And so we want to always be open to any types of treatment because, again, every person is different, and it can be therapy, medication, exercise, other treatments. Really, the sky's the limit in some way for treatment because people respond differently to different stimuli, different treatments, and so we continue every day in science to discover new ways to help people through this, and that's just a beautiful thing. And it's, again, the openness and understanding of it is really what we need to be holding on to here. And again, there's so much you can do to help people through this. And even if they're not actively recovering, there are still things that you can do to help someone. Even just initiating conversations about these things, or initiating treatment, initiating getting the person help. And so there are definitely things that both the patient themselves and those around them, their loved ones, can do to help them through these things. Even though it's very complicated and challenging, it's possible to recover, in short. Now, this next myth is very short, and it's addiction is lifelong. Now, in my experience, there are some behaviors in individuals that can be lifelong, but the addiction itself is not always lifelong. That's the myth part here. And the truth is that substance use disorder is different in every person, where some can deal with it for years and others manage to respond to treatment quickly. The goal is that each person can achieve their own recovery from substance use disorders, allowing them to lead a healthy and productive life. Although an active addiction may resolve, the process of recovery is lifelong. Now, this is important, and as I've said, the behaviors can be lifelong. The feelings associated with that can be lifelong. But addiction does not have to always be lifelong. We ideally don't want it to be lifelong. We want recovery, we want prosperity, we want peace and positivity in one's life to be brought about. And so, as the article says, it's different in every person. Again, we have to reiterate, this is one of the most important things, at least in my mind, to addiction, is that every person is different, and we will get different results, different treatment plans, and that's beautiful that is the case. Even though it's challenging, we can find different ways to treat people every single day if we just remain open and we remain understanding to those things. And as it says again, the goal is that each person individually can receive recovery. And the important thing too is that it's a substantial recovery, in that it can lead a healthy life. Someone can lead a healthy life even though they've experienced these traumatic things in their life, and their loved ones have experienced that along with them. It's important that they achieve this healthy life that they've been seeking. And the active addiction typically resolves in the lifetime if recovery can happen. And the process of recovery is the thing that typically is lifelong. And even if an active addiction resolves, as it says here, the process of recovery can continue throughout one's entire life. And it's something that, if we're more aware of that, it can be a lot more beneficial, because we can acknowledge that someone's struggles can be ongoing to recovery. It's not just a finite process. It can be lifelong. And so being aware of that can be very, very helpful and very life-changing for someone and those around them. The next myth that this article highlights is people can't force someone into treatment. If treatment is forced, it will fail. This is a very complicated subject here, because typically when someone is ready to be in recovery from their addiction, that's when it can be very powerful for them. It can be empowering. It can drive a lot of recovery, a lot of the process to recovery. However, again, these definite words make it problematic in these myths, which is, if treatment is forced, it will fail. And meaning this myth is that it will always fail if you're forced into treatment. And the true side, I will read it now, is treatment doesn't have to be voluntary to be successful. People who are pressured into treatment by their family, employer, or the legal system are just as likely to benefit as those who enter treatment voluntarily. People are often able to think more clearly as they recover, which can help foster change. This is definitely something that I've learned in my experience, is that, again, it doesn't have to be voluntary, And the people I've seen in my life who have recovered from this, they were pushed into recovery by their family and their friends and their loved ones. And they did recover, and they are living very happy lives now. And that's an amazing thing to see. And again, we want to, again, the definite words are what we want to avoid, which is sometimes, yes, it is sometimes the case that we may have to wait until someone's ready for them to be fully motivated to change. And even though they're in this traumatic state, in this different state than they normally would be without this disorder, it's also, they can still be motivated and they can still want to recover. And this can be very powerful. Again, it goes back to willpower. It can be very powerful. But it's also important to understand that it doesn't mean that if you are pressured or forced or pushed into treatment that it's not going to work. That's the part that is part of that's mostly what the myth is that if you're pushed into treatment, it won't work, which is not usually the case. Usually the case is that if you are pushed, even if you are pressured into recovery, if you find the right treatment plan, if you find the right resources that work for you, treatment can very well happen, and it can very well lead to recovery in anyone's life. And so I think personally it's more about the balance that you find. It's more about the combination between the person and the treatments that can really change someone's life for the better and get them on the road to recovery. And so even if it's different circumstances under which someone enters recovery, in other words, whether they enter voluntarily or involuntarily, it can still lead to amazing things in their recovery journey. And so it's important to acknowledge both perspectives here, that yes, it's important to understand how someone's mindset is during this time. In other words, are they ready? Are they not? How is this affecting them? How is it affecting those around them? And it's important to just keep all of these things in mind. We don't have to push any information away or only lean on certain information. It's all about what is important to the person, what is important in their life, what has proved to be beneficial for them. And it's a family effort as well. You know, any of their loved ones, any of their friends, any person in their life that is also experiencing this alongside them, they're involved in it too. And so it can be a really fruitful thing when we just keep everything in mind, keep all of these little details in mind, and focus on the individual person rather than generalizing. That's something that we want to typically avoid, is generalizing, and we want to steer more towards what does the individual need in their recovery journey. That can be very helpful to focus on the individual and their needs. The final myth that is highlighted in this article is medications used for substance use disorder are just a replacement for the drug itself. And although I don't have the knowledge to speak about individual medications and how they work, I do know that in my life I have seen successful use of medication and successful, effective processes of medications. In other words, they have proved to be beneficial in many individuals' recovery, and I've seen that in my life and the people I've interacted with. And this is highlighted in the truth of this topic, which is medications for substance use disorder are designed to treat withdrawal symptoms and cravings and allow a person to recover without the use of the substance. These are medications just like any other medication designed to treat chronic illness. And as I have just spoken about, I've seen that this can lead to successful recovery. It can help in successful recovery. And it's important to be open about the possibilities of what medications can do for people and that they can be very beneficial. And of course, they're not all effective on everyone. And it's important to notice both sides, that sometimes, yes, they can be ineffective, but they also can be very effective. And it all depends on the individual themselves. And so, again, the main themes here are every person is different. and that is a beautiful thing despite its challenges and complications that can come with it. And also, due to that, everyone's recovery process is different. Everyone's responses to different treatment plans are different, and it's all going into this main idea that it's important to be understanding, empathetic, and just generally open to these possibilities of how someone can experience their addiction, how they experience recovery, and ultimately how they use this recovery in their life and how it affects the rest of their life. And so this article was incredibly beneficial and incredibly interesting to look through because it gives multiple perspectives, and how even though researched information is incredibly useful and important, it's also important to consider how people feel while going through these experiences. And because every concern is a valid one, and it's very understandable in these circumstances, especially in these emotional states that people find themselves in, whether it's loved ones or the people themselves in the addiction, it's very important to consider that people's ideas, people's thoughts and beliefs about these matters are all valid to consider and to understand, because there is truth in everyone's feelings. Everyone's feelings are true, everyone's emotions are true. And so being open to all of these things can really foster an amazing environment of growth and reassurance through the recovery process. And so I hope that this has been beneficial for you all to hear this analysis and to just have some support and to know that you are not alone in any of these troubles or any of these situations. And again, I want to emphasize, if any of you or someone you know are experiencing anything to this extent, any troubles relating to these matters, I would encourage you to please reach out to a trusted individual, a trusted service, or a medical professional so that you or another person can get the help that you need. These are extremely difficult things that people can experience in their lives, but I truly believe that recovery is possible if we stay open, if we stay understanding, and if we have that perseverance to continue. And if we know how special our purposes are and we know how special we are, it can also add to the hope for our future and for our recovery. And I hope that this has overall been very helpful for you all. And again, you're not alone. Recovery is possible, and I'm here for you. Please know that you are special, you have an amazing purpose, and no matter what you experience in your life, you can overcome it. Whether it takes many resources or just a few resources, you can overcome any situation with the proper balance, the proper resources, the proper combination of what's right for you. And I believe in you. A link to this article, as well as a few other helpful links related to these matters, will be in this video's description so that you can get further information, further support, and ultimately further help. Thank you all so much for watching this video, and again, I truly hope that it is a good resource for you, or at least just provides some support or even more knowledge of this topic, because it's a very important one, and it's important to treat it with care and attention, and ultimately just the love for helping others. So it's a great thing for you to be seeking support or just seeking knowledge. So I want to thank you for just being open and just being extremely kind, and to want to help either yourself or others, or even just wanting to educate yourself on these topics so that you can help either, again, yourself or someone else in need in the future. And that ultimately is such a huge thing for our world, even if it's just one case. And so, thank you all so much for watching this video, and as always, thank you for your dedication to helping yourself and others. Goodbye!